Hi everyone, I'm Holly Harris and I am currently the Interim Health Services Director. As you can tell by my title, we are in a time of transition at the Health Department as our prior director, Janice Garceau, retired in June. We hope to have a new director hired in the fall, hopefully. You will hear today from both the Interim Behavioral Health Director, which is the role that I am normally in, and our Public Health Director as well. Public health and behavioral health are both governed by many different rules and statutes, but it's important to know that our Board of County Commissioners is designated in statute as both the local mental health authority and the local public health authority. They determine policy, FTE, and budget amounts for the health department and play a critical role in supporting the health of our community. Our main purpose and our mission is to promote and protect the health and safety of our community. That really drives everything that we do on both the behavioral health and the public health side, and we are really committed to that mission. As you can see, the health department is comprised of 3 service areas. The Behavioral Health Division is the largest with approximately 280 or so FTE, so full-time employees. The Public Health Department has about 60 employees, and the Administrative Services Division has about 75 employees. While there's some overlap in the work that public health and behavioral health does, such as opioid response and surveillance, emergency preparedness, and suicide and substance use prevention, among others, the 2 service areas really are governed by many different rules and statutes and contract requirements, and are funded very differently, which you'll hear lots more about in future slides from both Amber Clegg and Heather Kaisner. The Admin Services Division is there to really support the work of both public health and behavioral health through fiscal support, contract, facility, operational, compliance support, among many, many other things. Really keep the wheels on the bus for our organization, and we depend on them heavily to be able to do the work and carry out our mission. We cover every corner of Deschutes County, all the way from LaPine to Sisters to Redmond and everything in between. And you're going to hear in more detail, much more detail, the roles and responsibilities of both public health and behavioral health. We really look forward to seeing you in person and answering any questions that you might have in September. And we really hope you enjoy our presentation. Thank you.
I'm Amber Clegg, an Interim Behavioral Health Director, and I'm here to give you an overview of Deschutes County's Behavioral Health Division. Deschutes County Behavioral Health is certified by the Oregon Health Authority as a Community Mental Health Program, or CMHP, which provides safety net services to people with serious mental health and substance use concerns. As a CMHP, we act as a bridge, connecting people with community-based resources and providing a range of care like intensive adult youth and family outpatient treatment, crisis support, forensic services, and intellectual and developmental disability services. And I'll share more about these services in the next few slides. What does it mean to be the safety net? Well, what it means for a CMHP is that we serve everyone with OHP, the Oregon Health Plan as it's called, Medicare and commercial insurance, as well as uninsured individuals who meet criteria for our services. We serve all people with crisis and acute needs regardless of insurance coverage, and we provide the full span of state-required services for all ages, and I'll go over that in more detail here soon. And we serve everyone within 24 hours or 7 days depending on need. And we do this all without ever closing our front door. CMHPs, what do? Well, they help to work upstream to reduce cost of higher levels of care. We try to help prevent people from going to the hospital or to the jail wherever possible, and we work to meet people where they're at. We also work to reverse trends towards incarceration and homelessness for those with serious mental illness, and we address chronic conditions and reduce the risk of early death. The community health programs are the safety net entity that stands in the gap between hospital level of care and the community. We serve a number of populations here in Deschutes County. We focus mostly on high acuity and high need individuals. Some of the diagnoses and conditions that we treat include schizophrenia, PTSD, or post-traumatic stress disorder, severe depression and anxiety, substance misuse, people at risk of hospitalization or jail, significant suicidal risk, and those that are unable to care for their basic needs due to their mental health conditions. Crisis services. I'll share a little bit more about our safety net services, which does include crisis. We have 24/7 crisis phone line coverage. It's available to anyone experiencing a crisis or needs crisis support. Most people these days dial 988, and that's a direct line to crisis support. We also offer 24/7 walk-in crisis services. This is at our stabilization center. It's at the north end of the town of Bend. This provides immediate access to a crisis clinician for anyone experiencing a crisis. It's open to all people of all ages, regardless of ability to pay. In fact, we don't charge for crisis services at all. It's safe and confidential, and it offers a warm and welcoming environment. As mentioned, it's available 24/7, and you don't need an appointment to access these services. It provides brief stabilization and resource connection. And also it offers short-term respite unit where we can provide up to 23 hours of stabilization and support for someone who needs that. In addition to our stabilization center, we have our Community Crisis Response Team, or CCRT as it's sometimes referred to. This was started in the spring of 2023 through a partnership between 911, our local law enforcement agencies, and our Department Health Services. It provides mobile crisis response in the community by health services staff to 911 calls related to mental health concerns. So staff go out in the community and meet with someone who contacted 911 due to their mental health concerns. This avoids many times not having to involve law enforcement so that they can focus on other needs in the community. So far, approximately 86% of CCRT encounters are resolved without officers. One of our other safety net mandates are forensic and residential services. These programs coordinate with law enforcement, the DA's office, hospitals, and residential programs to support people with behavioral health concerns who have been civilly committed, charged with a crime, or need a high level of structured support. The team also works to divert people from the jail by intervening in the community and helps to coordinate our mental health court program should somebody find themselves involved in the criminal justice system. In addition to the safety net services that I just described, we also provide many core services. Some of the core services we provide as a CMHP involve therapy, group therapy, psychiatric or medication services, nursing, peer support services, which are people with lived experience that have had mental health or substance use concern and help others in their journey. We provide skills training, case management or resource connection, and at one site we offer occupational therapy. Staff work out of 5 clinic hubs throughout Deschutes County and 7 school-based sites. This covers Bend, Redmond, Lapine, and Sisters, as well as we have a school-based site in Gilchrist on the very northern edge of Lake County. One of our core services focuses on children and young adults. We offer intensive outpatient services that include our wraparound program. This program offers community-based support for eligible youth and families on the Oregon Health Plan. Usually youth and families in this program have had involvement with child welfare, the juvenile justice system, are struggling in school, and might be having difficulties staying in their home due to their mental health concerns. Our ESA program, Early Assessment and Support Alliance, this offers supports to individuals ages 12 to 27 who suffer from the kind of psychosis that would lead to schizophrenia if left untreated. So it's a very early intervention program to help mitigate the potential risk of psychosis and having those symptoms end up being chronic. Our YAT, or Young Adults in Transition program, also offers supports and services for young adults. The age range is 14 to 25, and these are services for children and adults, young adults that suffer from mental health and behavioral health challenges, many times needing help in their transition from being a teenager to an adult and have very little support to do that in their lives. And then we have the Drop, which is a safe place for youth to drop in during business hours. We have one of these located in Bend and one of them at Redmond in our North County hub area. And both those drops are utilized pretty heavily. We also have intensive outpatient services for adults. So some of those programs include the Assertive Community Treatment Team, or ACT. These are high-intensity services for individuals who are most at risk for psychiatric hospitalization and for whom traditional outpatient services have not been successful. They usually work mostly in the community, at people's homes, and at the hospital. Vocational services also are provided under this umbrella. These are services for any open Deschutes County client with a serious mental health diagnosis who wants to seek competitive employment. This is a highly successful program and one that provides a lot of meaning to our clients. Older Adults program provides specialty community-based services with the goal of stabilizing and supporting high-risk older adults. And then community support services is kind of a blend of community and office-based services focused on treatment and supports for individuals living with a serious and persistent mental illness. Usually the diagnoses covered within these teams are schizophrenia, schizoaffective disorder, severe bipolar, things in that realm. And then lastly, we have our Homeless Outreach Services team, and they provide direct street outreach and community management support to individuals with serious mental illness or substance use disorders to prevent homelessness, or for those who are experiencing homelessness. So they work out in the community, they go to encampments, they go to people's homes, and they work steadily to address mental health and substance use concerns while also supporting them getting into or staying in their home. In addition, we also provide regular outpatient services. So this is going to be more clinic and school-based services, but they do provide some support in the community too. They're just a little bit lower level of a service than the programs that I just described to you for children and adults. So regular outpatient services are offered for children, families, and young adults as well. People still usually participate in a variety of services here. We have screenings and assessments. We provide individual, family, and group counseling, case management and care coordination, along with skills training, provide co-occurring substance use and mental health treatment and recovery services, peer support services for mentoring and education and assistance in navigating the treatment process, as well as some vocational and employment support and care coordination and referral services. Lastly, we have our Intellectual and Developmental Disabilities program. The IDDs and DD program helps determine whether people are eligible for these types of services. So they provide extensive and comprehensive intake and referral services. They also provide information about resources, connect clients and families with existing programs in our community, and facilitate the development of needed services that are not being already provided here. They also heavily collaborate with foster homes and support individuals to live independently wherever possible. I hope this review was helpful. It was brief, but also a lot of information. We have, quite the dynamic and varied teams within the Behavioral Health Division, just doing a lot of work for our community every single day. Heather Kaisner is up next to share about our Public Health Division. Thank you very much.
Hello, County College. My name is Heather Kaisner. I am the Deschutes County Public Health Director. So I'm just going to talk a bit about public health and what we do here in Deschutes County. As local public health, it really is our job to protect our community from the spread of disease and promote health. Each local public health authority in Oregon is required to deliver or assure all of these services listed. While some of these programs provide important direct service to individuals, such as WIC, which is our Women, Infant, and Children program, and Nurse Home Visiting programs, the majority of these services and programs really touch all of us and work quietly behind the scenes to keep our community healthy and safe. So here's a bit of a breakdown of our structure within public health and how we're organized. We really have 4 different service areas plus our administration, which is where I sit. I'll now share a little bit about each of our 4 areas. So our communicable disease prevention and management team receives and investigates reports of communicable diseases, outbreaks, or epidemics from healthcare providers 24/7 as required by Oregon law in order to prevent and control the spread of communicable diseases. They also mitigate health threats through epidemiology surveillance and prevention education, as well as assure access to public health services and conduct community outreach, providing immunizations, infection prevention consultation, mainly within long-term care facilities, as well as STI testing and treatment. So did you know that our CD, or communicable disease team, responds to over 1,000 communicable disease reports from healthcare providers? This includes healthcare providers who are required to report many diseases to us. We go into action very quickly to figure out where the case may have gotten the illness, as well as notify contacts of the case to try to prevent further spread. And some of these diseases that we work on include sexually transmitted infections, such as syphilis, chlamydia, and gonorrhea, vaccine preventable diseases such as pertussis, which unfortunately has been on the rise in the last few years here in Deschutes County, measles. Luckily, we have not seen a measles case in some time, but are definitely worried about that one, as well as hepatitis A and B. We respond to foodborne illnesses such as Salmonella and E. coli, as well as vector-borne diseases such as Colorado tick fever and tularemia. Our prevention and health promotion section is a dynamic program area which really provides population policy and environmental change that contributes to better health and well-being for our communities. An example of this work is our tobacco-free program, which has been around for many years, who really work to create a smoke-free environment. So Healthy Schools is one of our programs, and did you know that it's a 50-50 partnership between Deschutes County and Ben Lopine Schools to place public health specialists in high schools as part of school staff. These specialists serve as school health coordinators for their high school as well as middle schools, and they focus on topics such as adolescent suicide ideation, vaping, bullying, social media risks, as well as tobacco and alcohol use and other emerging risks, which increases the likelihood of negative consequences into adulthood. This initiative and program really allows public health to be more efficient and effective in reaching students, families, to help increase social, mental, emotional, and physical health supports within schools. Our family support services programs are focused on providing public health direct services to individuals and families, including perinatal education and care coordination, nurse home visiting programs, nutrition education, access to healthy schools, breastfeeding support, and referrals to needed resources. So did you know that participating in a WIC nutrition program and nurse home visiting really does support the long-term health effects of women, infant, children, and families in our community? This special supplemental nutrition program for women, infant, and children, known as WIC, is a program that helps pregnant women, new mothers, and young children eat well, learn about nutrition, and stay healthy. WIC provides nutrition education and counseling, breastfeeding support, nutritious foods, as well as help accessing healthcare. Nutrition education really is the cornerstone of the WIC program. Our nurse home visiting nurses visit families in their homes to assess the health of the mother and infant, as well as provide comprehensive connections to community resources that support the long-term well-being of the entire family. Visits include a health check for mom and baby by a registered nurse, support with infant feeding, bathing, crying, sleeping, and swaddling, as well as education about what to expect as a baby grows, and home safety education and parenting resources. And I have to say, as a parent of adult children, I wish I would have had this program when I had babies. It's a pretty wonderful service that we provide. The Environmental Health Program works behind the scenes to keep our food and water safe through inspecting food establishments, public pools and spas, public water systems, as well as responding to environmental health hazards such as lead, mold, and air quality. This section also focuses on all hazards, emergency preparedness efforts, to help the community prepare, respond, and recover from disasters. The team provides linkages between community partners, county emergency management, and various state agencies to ensure coordinated response and health needs are met during a variety of incidents, such as wildfire evacuations, winter storms, and communicable disease outbreaks. This section also includes the importance of disseminating health information regarding local public health risks and threats, as well as advising individuals on the necessary steps to safeguard themselves and their families. So when we talk about environmental health, we often think about restaurant inspections, which are very important to protect the public from foodborne illness. Did you know that environmental health also inspects all of the mobile food units, which continue to increase here in Deschutes County? This keeps our team very busy. They also conduct food handler education and trainings to over 250 people a year, as well as provide business consultation and support to over 1,000 businesses. So the other thing that we also do as part of public health and to make sure our community is engaged is we provide many different community education as well as newsletters to keep you all informed of what is happening within our community when it comes to health. So some of these are our monthly Central Oregon Public Health newsletter that is read by over 42,000 people in Central Oregon. And last month's edition included lots of important summer tips. Our communicable disease epidemiologist also produces 2 public reports. One is the weekly respiratory report during respiratory season, and the other is a quarterly public health data report that highlights disease trends within Central Oregon. We also have opportunities to volunteer through our robust Medical Reserve Corps, whose mission is to protect the health and safety of our communities and help build resiliency through maintaining a pool of medical and non-medical volunteers that are trained, passionate, and ready to respond when health-related crises, emergencies, and natural disasters occur. So if you're curious about any of these opportunities to stay engaged or connected or just really up to date on public health issues, definitely visit our website on the Deschutes County Health website. So this is really just a few examples of how public health really truly touches all of us in our lives every day, and you may not know it. I look forward to meeting you all very soon at County College. Thank you.